Hi, I'm Denise Willis, Section Editor for Respiratory Care. This video abstract will discuss the paper High-Dose Nitric Oxide from Pressurized Cylinders and Nitric Oxide Produced by an Electric Generator from Air, authored by Gianni and colleagues in the February 2022 issue of the journal. Inhaled nitric oxide is a pulmonary vasodilator used for treatment of severe or refractory hypoxemia. High-dose nitric oxide has been found to have antiviral effects. Nitric oxide can be delivered with a pressurized gas cylinder or an electric generator. This study evaluated feasibility and safety of delivering high-dose nitric oxide to healthy volunteers using cylinders and an electric generator. Subjects were healthcare workers who worked with patients with COVID-19 at least 3 times a week. They were randomized to a treatment or a control group. The treatment group received 160 parts per million of nitric oxide for 15 minutes twice a day over 14 days. Non-invasive methemoglobin, pulse oximetry, and heart rate were recorded before and at the end of nitric oxide administration. Subjects chose which nitric delivery system to utilize. Nitric was administered by face mask using this pictured setup. A constant reservoir gas flow of 15 liters per minute was used to avoid variation of nitric gas concentration during the respiratory cycle. Nitric oxide and nitrogen dioxide were monitored through sampling ports in the inspiratory limb. 24 subjects were enrolled, with 12 in the control group and 12 in the treatment group. The treatment group included 6 males and 6 females with a mean age of 43 years. All subjects received nitric oxide with pressurized cylinders, while 3 subjects utilized both cylinders and the electric generator. Nitric flow was set at 4 liters per minute with the cylinders and 2.5 liters per minute with the electric generator. FiO2 was 21%, and to maintain this when the cylinders were used, 1 liters per minute of supplemental oxygen was added. Non-invasive methemoglobin significantly increased with both delivery systems, but the difference between the cylinders and the electric generator was not significant. Methemoglobin was decreased with both systems after stopping nitric oxide. Delivered nitric oxide concentrations were significantly higher with the use of the electric generator, and the difference was attributed to a higher total gas flow when the cylinders were used. There was not a significant difference with monitored nitrogen dioxide. Pulse oximetry was slightly decreased with use of the cylinders, but was not changed with the electric generator. Heart rate was slightly decreased with both systems. None of the subjects reported any discomfort or developed cough or wheeze. High-dose nitric oxide delivered for 15 minutes twice a day was well tolerated and without adverse events in healthy volunteers. Both systems resulted in an increase of non-invasive methemoglobin. Nitrogen dioxide was a little higher when the electric generator was used, but the difference was not significant and remained below established safety levels. The study was limited by the small number of subjects and early termination due to the introduction of COVID-19 vaccines. The type of nitric oxide system used was based on availability and subject preference and ended up resulting in unequal numbers of the devices used. In conclusion, this is the first pilot study of feasibility and safety of high-dose nitric oxide using an electric generator, and the gas delivery between the cylinders and the electric generator was found to be comparable. Thank you for tuning in. You can follow the journal on Twitter and Facebook and subscribe to our YouTube channel.